on Family Radio, also live on Family TV, where we're keeping Jesus on the airwaves. Today is the 2nd of November, yet another month that the Lord has made. Thank you so much for joining us today. You can use the WhatsApp number 0786 316 316, SMS line 20316. During this show on Facebook and Twitter, you can talk to us through the handle Family Radio 316, and that's where we get to chat and get to know what is happening across the country. Well, today we will be talking about the universal health care. Do you have access to good healthcare facilities? Do you have access to good healthcare services? That's what we will be talking about, and how we can help to improve that. But in the meantime, we get it started. Now, learners at home have to wait longer to know their fate in regards to the first reopening of schools. Speaking while inspecting the Mukuru Primary School in Nairobi, Education Cabinet Secretary George Magoha said that deliberations are still ongoing to determine the way forward on reopening of schools for the learners still languishing at home. Now, the professor explained that after the meeting between the president and the governors, the ministry will organize another meeting with the education stakeholders so that a proper decision is made.
The disease raging, one senior procurement manager at the Kenya National Examination Council succumbed to neck. She was not old, she was not unhealthy. So COVID is actually real, and let us hope that we change our culture of impunity against ourselves. And for that reason, we have decided as government for now that those students who are in school, like you have seen them, they should continue to be in school. Because life must continue as long as we obey the protocols that are given, which unfortunately most of us are not obeying. If you look at those children, they are all masked. Then go out of the school and you see the children outside and find out whether they are masked. So are they not better at school?
Well, and that is where we get our discussion of the day today. Between being in school and being at home, where do you think our children are safe? Is it at school or is it at home? Talk to me using the WhatsApp number 0786 316 316, SMS line 20316. Where do you think the children are safe? At school or at home? Now, members of parliament allied to President Uhuru Kenyatta and the ODM leader Raila Odinga have said that they are ready for a referendum. The legislators drawn from the Senate and the National Assembly today said they have broken down the content of the BBI report and resolved to render it unwavering support. This comes after the legislators held a meeting with President Uhuru Kenyatta and Raila Odinga in Naivasha, and they were led by Siaya Senator James Orengo, and they said through the one nation, one country philosophy that BBI speaks and seeks to ensure that no region is left behind.
BBI seeks to give the youth a chance to get out of poverty by creating opportunities to make an income, to get financial support for their businesses, to ensure that they are paid promptly and they have greater participation in the tendering processes. Based on these issues and the fact that BBI stands for one nation, one country, we stand here today on behalf of the approximately 300 members of parliament from both the National Assembly and the Senate to declare our total unwavering commitment to the BBI. We are ready to proceed popularizing the report across the country. We have a schedule of activities that would culminate in a referendum to bring very meaningful and very far-reaching amendments to the Constitution. Yes. We are requesting all leaders and citizens of Kenya to join together with us in this noble process of a new constitutional order for the benefits of all Kenyans. Not any one person is greater than Kenya. Yes. Kenya, the nation, is greater. Yes. BBI is the fulfillment of the words of the national anthem. Yes. justice be our shield and defender. May we dwell in unity, peace, and liberty. Let it be found in our border. BBI! BBI!
And still on matters BBI, the Deputy President William Ruto has said that it is possible for the country to strike a consensus on the Building Bridges Initiative report. He said a mechanism to bring together all divergent views on the initiative would spare the country from being plunged into unnecessary contest. And he spoke today at his current residence in Nairobi when he met more than 1,000 Kamba professionals from Makueni, Kitui and Machakos counties.
We were read in Bomas, Isaiah 1:18. Come, let us reason together. I think in that spirit, let us find a mechanism for building consensus. Let us find a mechanism that unifies the country. We cannot build consensus by creating factions. We cannot build consensus, or we cannot build unity using divisive means. It's possible for us to agree on the matters that require legislation, they be dealt with. On the matters that are administrative, they be finalized. On matters that are constitutional, let us find a consensus on all the issues, whether it is the judiciary, whether it's the IBC, on the Senate, on devolution, on representation, so that we can move the country together. Let me request that way we can truly and sincerely be known that we want the unity of the country. You cannot unify the country through division. Yeah? You cannot say, let us lock these ones out, let us bring those ones in, and the mission is to achieve unity. To achieve unity, let us bring all people together. Let us bring all opinions together. In any case, there are no superior or inferior opinions or ideas. Let us sit, and as they say, a good idea will give way to a better idea. And that way, we can take the country forward.
Well, I don't know about you, but I like what the Deputy President said. All right, now, on the question that we are asking today, and it's about the COVID-19 numbers and the safety of our children. Now, do you think the children are safe at home or at school? So it's either the schools or our homes. Where do you think they're safer? Talk to us through the WhatsApp number 0786 316 316, SMS line 20316. And still on matters COVID, the number of the cases in our country has risen to 56,601, and this is after 724 more people tested positive in the last 24 hours. The sample size that was tested is 5,085, and the positivity rate stands at 14.2%. Now, at the same time, 14 more people succumbed to the virus, now raising the total number of fatalities to 11,027. And the number of recoveries within the last 24 hours rose from 37,442 after 248 more people were reported to have fully recovered from the disease. Now, currently, we have 54 patients battling COVID-19 in the intensive care unit, that is the ICU, and 26 of whom are on ventilatory support and 28 on supplementary oxygen, and another 55 are on supplementary oxygen, out of whom 45 are in general wards and 10 on the HDUs.
In the country, we have reported 724 people who have tested positive to the virus today, from a sample size of 5,085 just in the last 24 hours. This means our positivity rate today is 14.2%. Our cumulative tests now at 704,605. We have a 1-year-old baby who has been infected, while there is also an 84-year-old man who has been infected. 248 patients have recovered from the disease, 178 from home-based care programs, and 70 from various hospitals. I want to say also, the story is circulating around in the press, but we are totally overwhelmed by the disease in terms of our bed capacity. Is actually not true.
Well, and on that note, please remember that the Inspector General of Police has said that if you are arrested without a face mask, you will be charged a fine of up to 20,000 Kenya shillings. He said that today on his Twitter handle, where he was engaging Kenyans on some of the issues that affect Kenyans. 20,000 Kenya shillings, confirmed by the IG himself. So we better take care of ourselves. On the question of the day, Marion, you're saying students are safer at home. You're watching from Kikuyu. Thank you so much for tuning in today. And this is Rose Judha, and you're saying a hard question. They can only be safe in the hands of God. Thank you so much for tuning in today. Send in your responses about the question that we are asking. Between our homes and the schools, where do you think the children are safer? Today we have Ruth, who is saying, in this instance, I agree with C.S. Magoha. The kids outside are not protected at all. Remember, most parents are back to work, so kids on the streets and all others without their face masks are not social distancing. So Ruth, according to you, and if I'm getting you right from the from what you have texted, the kids are safer at school. Thank you for that. Mary, asante sana for tuning in today, and you're saying our children are safer at school. I like that. Huyu anaitwa Dixon Tello, and they're saying good evening. The playlist is really uplifting. I'm listening on my way home. Thank you so much for tuning in today. Well, and as earlier promised, our health system, how is it? And remember, just the other day, the president reintroduced to us and actually just put it out there that we need a universal health coverage. That is what he has been pushing for. And it's also one of the big 5 agenda of his government. Good healthcare system. And talking of that, today in studio right now, live, we have Dr. Ancient, I hope I got that right, Kituku.
Ancient.
How are you doing?
I'm good.
All right. Well, thank you so much for joining us today. And I want us to first define what is universal health coverage.
Thank you, Sarah. Basically, as you are aware, UHC is one of the big 4 agenda of His Excellency the President, Uhuru Kenyatta. And basically, in simple terms, what it means is basically ensuring that every Kenyan has access to quality healthcare, which is affordable. Yes. So it's all about ensuring that there is equity in access to quality healthcare, and which is affordable. And the main reason for this is we know that since by the time we are getting independence, this is one of the challenges our founders of this nation. And up to now, 50 years later, we've not been able to achieve that. And we've seen people suffer because of lack of poor healthcare. We've seen people who had some properties actually become poor when they get sick, first get sick, because some have had to dispose of their properties, be it land, houses, cattle, whatever it is, to be able to access healthcare. And definitely that's one of the things which needs to be fixed, so that when we get sick, we don't also get poorer than we were.
I like what you're saying. We need to fix this because when we get sick, we don't get poorer than we were. And I'm thinking, do you think the healthcare system in our country is good and it caters for this, what you've just said? Preventing people from getting poorer when we get sick?
Yeah, let me give some perspective. Remember, I think it was around in December 2018, is when the president launched the universal health coverage journey. Again, let's remember, it's a journey, it's not a destination. So meaning that it's something progressive.
Yes.
And what then was in December 2018, the president and 4 governors, including Machakos County Governor Dr. Alfred Mutua, signed an agreement to pilot a universal health coverage in those 4 pilot counties. And then is now after that pilot is when now the president now over this weekend now roll out the universal health coverage to the rest of the 43 counties. So I want to correct that perception that is like the president has relaunched.
Yeah.
The correct position is what was launched in 2018 was a pilot. Now what is now the rollout to the rest of the country. Yes. And now to answer your question is, of course, health is a very complex issue and is quite expensive. There are a lot of many things which need to be fixed, and therefore that's why we are saying it is a journey, it's not a destination, and therefore we keep on improving these systems progressively. Yes,
I like what you're saying, and you know, you keep insisting on a certain statement that I feel most Kenyans should actually look into. Health is, it's a journey, it's not a destination. Health coverage is a journey, not a destination. And I'm looking at it this way. One of the major challenges that we're facing as Kenyans is actually in terms of the healthcare. You know, look at it this way. We have some counties that do not even have hospitals. I remember the other day, one of the issues that came up is on the issue of one of the counties, is it Baringo County or Pokot County, where people have to walk for longer distances before they can even access a health facility. But from what we are looking at, when we incorporate now the UHC, that is universal health coverage, this is some of the things they're going to look into. Am I right?
You are very right, because actually I've mentioned there are 4 key pillars to be able to really talk about universal health coverage. We've talked about the access.
Yes.
And linked with the access is equity to access, because we've seen for a very long time, the best healthcare is in Nairobi, then followed by the other big towns. And that alone creates a big inequality, because the people in the rural areas in Mashinani really suffer because there are no hospitals really nearby. And that's why now the issue of equity is important, whereby there are guidelines which have been prescribed by WHO for quite a while, but to make it a bit simple, ideally everyone should be living within 5 kilometers of a health facility.
5 kilometers.
But within a radius of 5 kilometers, so that and the reason for that is in case of some emergency, so that to ensure that this person can be able to access health facilities. So those are the first 2 pillars: access, then the equity in the access. Then the third one is ensuring that we get quality healthcare for citizens. And again, we've noted that most of the times in Kenya, when we are talking about quality healthcare, is mainly the rich who can afford, because for a long time it has been that quality healthcare you can only access in private facilities. Yet, over 90% of Kenyans cannot afford to go to a private facility. They go to public health facilities. And therefore, as a government, it is our responsibility to ensure that our public health facilities offer quality health care as good as the ones we get in our private health facilities. And then the 4th pillar is to ensure that this healthcare is affordable. And affordable meaning that for those who are very poor, the so-called indigents, then there has to be a system for the government to ensure that they can access healthcare, even if they can't afford it. Then for those who are in employment and other sectors, then there's also the talk of ensuring that there's some social insurance, which basically can ensure that we pull our resources together and ensure that when we get sick, we can be able to get quality healthcare. Because you've seen even among the middle class, we live sometimes from hand to mouth.
Yes.
Find someone has a good salary, is running a good business, but then when they get sick, that salary or business cannot afford them to get quality healthcare. And for some, not some, but for a good number, even those in the villages, when they get sick or their loved ones get sick, then they dispose of their property. And they take it all the way from the minor one down there in the village, whereby a mother or grandmother gets a child who is sick, and they have to only go to which they were milking to get that person health care. Fair enough, that person might get well, that child, but then when they get back home, even the milk they were getting is not there because they got to salt.
Yeah.
Might be land, someone will dispose of it to get health care. So even if they get well, and we hope people get well, then they go back and they have nowhere to live because they sold their land or their house. And those are the things we need to sort, yes.
Okay. And that is a very sad example you have given, when someone really has to get rid of something and, quote unquote, to just pay for good health. And you have talked about affordability. So here is a case scenario, and this is of a friend of mine, and maybe even I had a case study from a colleague who said that alienda hospitali, and then because of the use of cards, you know, the way we use NHIF to make sure that they can pay for a certain percentage of our healthcare services. And then the bill was over 100,000, but what the card could only cover is 7,000 Kenya shillings. So that brings me to the question that I'm about to ask. Affordability. How far are we when it comes to that?
There are several things which come into play. One, and this has been noted, in fact, since the president even mentioned it. Why is it that an X-ray done in a public health facility and similar X-ray for the same, basically a similar X-ray done in a private facility will cost 10 times more? Again, what has been noted is for some reason our health insurer, now the NHIF, which is the main public one, you find when reimbursements are being paid, around 80% the reimbursement is done to private health facilities, and only 20% is to public health facilities.
Hospitals.
Yet, when it comes now to the attendance to those facilities, it's almost the other way around. 80% of Kenyans attend public health facilities, 20% are the ones who go to private. But when it comes to the reimbursement, it's the other way around. So the affordability is, of course, is something which we need to look at, we've been looking at, because obviously we know that when the technologies are not available, when they come, they'll be quite expensive. The same way when you remember when mobile phones came, the struggle, people had to pay a lot of money to get a line. Now, so those are one of the things. Again, obviously we must sort the wastage, because the way we've let's accept our society is a bit rotten, and there are those who really want to make a kill from people. I'm not saying private facilities should not make profits. They must, because they're in business to make profits. But those profits should not be crazy ones. And sometimes that money is not even going to them, to the owners of those facilities. It is corruption along the chain, which needs to be sorted so that we don't exploit our people, and again, we don't make the national insurer to be the poor. And this is something which needs to be looked at in a bigger perspective, because I understand even the private medical insurers also make this.
Okay.
That there's a lot of fraud in the medical insurance industry.
All right.
Public and also private, yes.
Okay.
Yes.
All right. So if you have any questions, we have the CEC for Health, and this is from Machakos County, Dr. Kituku with us. So if you have any questions, and especially when it comes to universal health coverage, just share with us. And in the meantime, Daktari, I want us to look at some of the responses and some of the questions that have come in. So we have one here, and this is from Sarah Wanaivasha, and she's saying, "Hello, Daktari. I like what you have put out in the statement that it is a journey, not a destination. But one thing is for sure, we are not yet there. Am I right?"
Yeah, definitely we are not there.
Yes.
And I can assure the lady from Naivasha, even the West, even America is not yet there.
Yeah.
That's why you find in the US, there's the discussion about Obamacare, whether it should be there, whether not, okay? But it's a journey which we must walk. And basically, what each one of us expects when you go to a health facility, when you are sick, we basically expect three things. One, you expect to find a doctor. And by doctor here, sometimes we mean a healthcare worker, because our people, anyone healthcare worker is a doctor. So you expect to find a doctor. That's one. Number two, you expect investigations, whether lab or X-ray, to be available. And the third thing, you expect the medication to be available. And medication here meaning that you are given some injections, some tablets, you are taken together for some operation. If it's a broken limb is fixed.
Yeah.
That's what we require. But then, of course, let's appreciate that there are 5 key components of health. And in a way, the lower ones are the most important. But again, as a country, for a long time, we focus so much on the treatment until we've forgotten the other very important components. The first one is health promotion. Where, as a country, as healthcare workers, as healthcare departments and the ministry, we need to continue running and sensitizing our people on importance of staying healthy. And that's very, very critical, because if we are healthy, then we don't need to go to hospital.
Yeah.
If we are healthy, it doesn't matter how far the hospital is. If we are healthy, it doesn't matter how much the bill is, because we don't need to pay any bill.
Yeah.
The second component is disease prevention. Again, we know that prevention is better than cure.
Yeah, sure.
And that's why, yes, disease prevention is very important. And it ranges from simple things like hand washing with soap. As most of us have noticed, since COVID-19 came, actually diarrhea diseases and respiratories among children actually have gone down because of the frequent hand washing, meaning it works.
Wow.
Issues like hearing people use pit latrines or toilets. People don't defecate in the bushes. Again, it goes a long way in preventing diseases. When it comes to cancers, now we have vaccinations which can prevent some of these cancers. So that's a very important component. The third one is now the curative, which basically everyone knows. You are sick, you get some medication, some injections, some surgery, so on. The fourth component, which is also very, very important, is rehabilitation. And the rehabilitation can be physical, mental, and so on. Like when someone probably had a road accident, their limbs have been fixed, but then they need to be rehabilitated to be able to walk again. Again, rehabilitation can be maybe someone who had a drug addiction. They need to be rehabilitated back to normal life without taking drugs. And then the fifth component is palliative care. This is mainly for terminal illnesses, cancers and other terminal illnesses, whereby we know this person will get cured, but then we need to give them quality health care, relieve their pain, ensure their nutrition is okay, ensure their blood is okay, and so on. Yes. And those 5 components are very important, all of them. None is more important than the other. But for a while, we've concentrated so much on the curative until we've ignored the other components. Yes. Yes, so to answer your question is, we are not yet there. And in fact, no country in the world has ever been there, because one, there are always areas to improve on. But the thing is, as my boss, our governor, is saying, Dr. Alfred Mutua, he keeps on reminding us that the West, the God the West worship is the same one we worship. As Africans, as Kenyans, as Machakos residents, we are not of a lesser God. We are all equal before God. And therefore, the quality of healthcare people in the US get should be the same as we get in Kenya and in Machakos. The quality of healthcare someone will get in the eye and the private hospital in Kenya should be the same one someone will get in Machakos Level 5 hospital. And that should be our basic operating
Procedure and standard.
Yes, because we are equal. We are not children of a lesser God. Yes.
Yeah, I like that. Well, the reason as to why I'm smiling is that someone said here, I really love what the Daktari is saying, but one thing is for sure, the government is really trying, especially when it comes to maternity health and reducing the mortality rate in our country. So yes, we are making steps. But there's one challenge that we have. Hii maneno ya strike, and especially amongst our healthcare workers. What is the solution to that? Because I feel like this is one of the major challenges that could maybe prevent us from getting there, to getting our destination.
The thing is, now under universal health coverage, there are the nuts and the bolts which need to be fixed. Of course, the big one, the main one is financing. Because without funds, most things may not move much. But then there's also the issue of strengthening systems, whereby we improve efficiencies and we ensure our healthcare workers are there to serve our people. Of course, the other bolt which needs to be sorted is the human resource health. And this is the issue where now what you talk about comes in, the issue of strikes. The thing is, some of the strikes which healthcare workers have gone into, in fact, some of them were to strengthen health systems.
Yes.
But now moving forward, is better, because usually a strike is the last resort. We need to be talking. We need to fix the issue of healthcare patient or population ratio. The WHO recommendation is 23 healthcare workers per 10,000 population.
Wow.
We are not very far from that.
Yeah, sure.
So obviously, that's an area we need to fix to ensure that we have adequate numbers of healthcare workers per population. Because it's one thing to ensure those facilities are there within 1 5-kilometer radius, but if the healthcare workers are not enough, then it will be useful. Of course, we also need now to also ensure that for specialized services, we also get the specialists who are required to offer those services, because not everyone can do a cesarean section. Not everyone want to fix a broken limb. Not everyone can be able to manage a patient in ICU. So we need to get those specialists. And of course, obviously also appreciate that healthcare workers work under extreme circumstances. We know sometimes we try to say, no, it's a calling, they need to do ABCD, but also appreciate that healthcare workers also have bills to pay. And when they go to a supermarket, for example, they don't have a special card which shows that this is a healthcare worker and sell them at 50% of what we say to the rest of the population. So that they need to look at, ensure that our healthcare workers are well remunerated. And in cases of like now when we're dealing with COVID-19, it's only fair because the healthcare workers who are treating our patients in isolation. Some of them have to go to quarantine themselves. We know we are changing them the protocols, but there are some where to be staying away from their families for weeks on end. And obviously, for sure, that person requires some extra allowance, not really to pay them, but as a way of appreciating them. People may not recognize that the PPEs we keep talking about, one, they are very crucial, because we must protect our healthcare workers, ensure that they don't contract this disease or any other disease in the line of duty. But then we should also appreciate that they are pretty uncomfortable. Being in a full PPE, the gown and all that, for 4, 5, 6 hours is not an easy thing. It's really, really uncomfortable. But healthcare workers persevere all that to basically ensure the rest of the population is healthy. Healthcare workers also work extreme hours. There are some who do, sometimes one surgery can take 6 good hours standing.
Whoa.
Yes.
That's quite some time.
Yes.
Okay.
So we need to look at all those factors and appreciate. But the bottom line is we should not get to strikes. We should be able to have a sit down, sort what is we are able to sort, because as a given now for them, the ideal working condition for healthcare workers is also a journey, not a destination.
Okay.
We will not be able to wake up tomorrow and we find everything is okay, allowance is okay. Journey, but which we need to be committed ourselves, all of us, to working together.
All right. I like what you're saying, and because of time, we really need to end this up. But before I read what James Karimi is saying, there is a comment that came in here, and we have about 2 more minutes. Tukipitisha hiyo, the producer will literally be on my neck. So someone says, "Hey Sarah, healthcare is tricky. I was rendered jobless from March 2020 this year, and when I checked with the NHIF, the penalty plus amount I should pay is great." Great in quotes, like it's just a big amount of money. So maybe, as you said, this is one of the things that we need to be addressing and correcting. And there's someone else here who is saying, and just let's keep this short very much, Daktari, how can I register for universal health coverage? This is James Karimi, as we finish.
Thank you. As we finish, I need to mention within that 1 minute that we learned a lot from the pilot, because if we don't tell people about the size of the pilot, then the road in the rest of the country might not be viewed in a good way. Through that 1 year pilot, we were offering free healthcare for the people we registered. And within Machakos County, we managed to register 1.2 million people, which was around 86% of the population, and been offering up to, including even today, free healthcare. And what we are able to achieve under the pilot is we are able to increase the number of healthcare workers, we are able to increase the number of healthcare facilities, we are able to increase even the number of ambulances, and we were able to really start doing specialized clinics with extreme areas where we never had gone before. So I'm saying is UHC is universal health coverage is achievable. We need to work together, and we'll be able to achieve more together. To answer the question of where they can register, is President on Saturday launched the registration. And each county, of course, now counties, of course, together with the National Ministry of Health, we are going to communicate on now to progress with this. And but we are encouraging people, because the NHIF is being reformed. And KEMSA, the main supplier for commodities, is also being reformed. So we encourage people, wherever they are across the country, to contribute to NHIF or any other mechanism they'll be told about, so that they can be able to access universal health coverage.
All right, so it's through NHIF. I hope you got that, Mr. James. Well, asante sana. Sorry. I've deliberately not said it is through NHIF because the National Ministry of Health and also the governors from different counties will be able to advise their people better. So deliberately, for now, I'm not saying it's through NHIF, but I'm telling people generally, it's important to have an insurance scheme, whether it's a private or the public one. Wow.
But it's important because health is wealth. So, but for which model of finance which is going to be adopted, for now I'm not able to talk about it because the governors and the Ministry of Health and of course even the President to advise on that. Remember, the meeting was just held on Saturday.
On Saturday, yeah.
So, it was just 2 days ago. So, and let's remember, universal health coverage is one of the big four agenda of the President. So the President and the Ministry and governors are going to advise people accordingly.
Well, thank you so much, Daktari. That has been the Machakos County Health CEC, Dr. Ancient Kituku. Asante sana, Daktari. Ancient. Hey, Zibajina. Anyway, thank you so much. Have a lovely evening.
Okay. You too.
All right. Well, and looking at what was happening in Tanzania just a couple of days ago, the Tanzania's President John Pombe Magufuli has received the winner's certificate in Dodoma following his victory in the last Wednesday election. Now, in his speech after receiving the certificate, the president said that he is indebted to Tanzanians as he takes power for a second 5-year term. He promised to work with the opposition candidate in his bid to deliver to the expectation of the people, whom he she thanked for his landslide victory.
Wakati Mheshimiwa Rais akiagana na viongozi na hatimaye makofi mengi na vigelegele. Na vigelegele.
All right, that is what is happening in Tanzania. And at the same time, we still have demonstrations that are ongoing. And this is because of the opposition leader, Tundu Lissu, who says that the election was not fair. Anyway, before we end this discussion of today, someone else talked about having our children at home because home is safer. Your number ends with 29. You didn't tell me your name. Thank you for contributing to the show. Good evening, my dear friend. In the name of the Lord and Savior. Okay, you didn't give me your name, but you're saying home is better. Zipporah, asante sana for tuning in today. And for everyone, including Ruth, who also tuned in and contributed to the show, thank you so much for tuning in to the show this beautiful evening. My name is Sarah Otieno, and as we start off this month, I pray for God's favor. I pray for blessings, and continue sending in your prayer requests and also your praise reports, because Prayer Circle is coming in next. Good night.
This and more of our shows, log on to www.familymediaonline.com to enjoy a wide variety of programs, from current affairs to testimonials and features, pastoral and inspirational shows, kids entertainment, and so much more. Also stream live on www.familymedia.tv.